Okay. Okay. Well, here we are. It's week 4 of Hermetic Medical Astrology class, and I will share the screen. I think that should have it.
Yes, sir.
And good. All right. Here. Okay. There we go. Okay, good. So this week, we're going to talk about correspondences between the signs in the anatomical zones in the body. And sign correspondences. We may get through this week, or we may carry over next week. We're going to do the signs now, and there are also planetary correspondences, and that will be the following class or classes from that. And so the rule here, and this is ancient astrology. This goes way back. I have been reading lately some of Alexandrian astrology with several. There are 3 authors from there, and they're using these anatomical zones in the same way we are, and they you will see at the end of the class they work. All right. We see, and as I was talking last week, we're looking for discords. It's the discordant aspects in the chart that will create discords in the health or in the anatomical zone. So we're looking for discords, but so we find that the signs correspond to anatomical zones. Planets may correspond to organs, or certain kinds of tissues, like Venus can rule the skin tissue, epithelial tissue, and also functions. So like Mercury, Aries may rule the brain, but Mercury may rule the brain functioning, right? So we're going to talk more about planets next time. But for tonight, it's anatomical zones, and the planets are important insofar as the signs have ruling planets. And the ruling planets, the energy that affects the ruling planets radiates into the signs, right? So often we'll find a disease or a condition is indicated in a certain anatomical zone, and there's no planet in the corresponding sign, and you will find the harmonies or discords in the rulers of the sign. So the planets affect the anatomical zones through rulership of their corresponding signs. Okay. This signs possess what we call thermal properties. They can be hot or cold, right? Or cool or warm. And also humid properties. They can be more damp or more dry. I found for the Church of Light course, if you look at the course on weather predicting, right? The course on weather predicting describes the thermal, humid, and what we call the windy properties, the movement properties of the different signs. And so you can see these sometimes expressed in the weather. We live in our society today, we live in a kind of a materialistic solitary confinement cage, right? As far as medicine is concerned, like medicine is almost completely materialistic. Medicine is considered to be giving somebody a drug. And if you look in the long history of medicine, and today parallel systems of medicine, and this would be Ayurvedic medicine, traditional Chinese medicine, the 4 humors medicine of the Greeks lives today as called Unani medicine in Pakistan and that area, and the Middle East. By the way, you'll hear about Unani medicine. They'll say Unani tib. And you'll say, what's Unani tib? Well, Unani is Arabic for Greek, and tib is Arabic for medicine. So Unani tib is Greek medicine for humor system. It's been practiced continuously since before the Greeks, right? We have plenty of evidence that it was pre-existing in Mesopotamia and Egypt before before Hippocrates was ever even born. So, but these, an assessment in Chinese medicine, you aren't going to look and you aren't going to find a few symptoms that this person has this disease. You're going to ask, is this patient more hot or more cold? Right? And is this patient more damp or more dry? These systems will do that. Ayurvedic medicine also. They're going to look for thermal and humid properties, and they may, certain conditions, they're going to look for what we call movement, like palsies or tremors or things like that would be, we call the windy properties. So I'm including this in the course. I'm not going to talk a lot about this, but this course will, I'm doing this in my elder years as a legacy course. This will outlive me, and in the future some Ayurvedic or traditional Chinese practitioner will be interested in this course, and they'll go, oh hey, this correspondences with astrology to what I do, right? And so some of you here, I'm sure, are familiar with that, with those concepts. So I did a long time. You can see a lot of times, well, Mars is hot and dry and so on, and you'll see some of the books about this. And I find there is nothing more elegant than our weather predicting course in the Church of Light, as far as describing which have warm and which are hotter and which are the hottest and so on. That it's a really nice description of the energies of the signs. Right? We have energies of the planets also. Okay. So this what I say here, the influences are recorded here for the benefit of health practitioners who use these concepts in their practice. And also I have a suspicion that the Mercury, the movements, the winds might be of interest to people who practice hands-on healing in those areas, that you might be able to feel that energy, or you might be able to do something if it's discordant to benefit it. So we'll start. Basically, if you could do a yoga pose where you stand on your head with a, like, curl around backward and put your feet on top of your head, right? You could do the zodiac right around your body, right? It'd start with Aries, Taurus, Gemini, Cancer, right? Leo, Virgo, and so on. All around to Pisces would be your feet, and then you'd have the, if you could actually do that, you'd have the zodiac. You would be the zodiac there. So I'll go through each of these in detail. Now, all of this is traditional, and we have C.C. Zane's descriptions in our Stellar Healing book, right? And some of the other courses of the Correspondences. And we also have, there are other sources. Last year, one of the gentlemen mentioned the book on astrodiagnosis by Max Heindel. That has a lot of correspondences in it. It has some more detailed correspondences than what we have in C.C. Zane. I consider, my approach to astrology, I consider every day is an unfolding experiment, right? To either verify something or re-verify something or reconfirm something, but I keep open to wanting to see some evidence. I want to see what's actually happening in the correspondences. So this is what I've done here. I'll have some charts in here for these different areas. Some of the things I found, if you look at the whole thing, some things are mentioned that most people don't know much about, like, for instance, the upper lobes of the lung or the lower lobes of the lung, right? Or, for instance, the internal reproductive organs or the external reproductive organs. Sometimes it isn't exactly precise, exactly what you're talking about with those. So I'm going to clarify some of those. There are other things that I find are open, like I couldn't find anyone referring to what ruled the esophagus, right? We have the stomach is Cancer, but what rules the esophagus? The tube that goes down to the stomach. And so I did some work on that. I also find that under Cancer, people say, okay, Cancer rules the breast and the stomach, right? And that's almost all you ever see. Zane mentions, oh, the lower lobes of the lung, right? And Heindel mentions the whole rib cage, right? And this whole area, and then the diaphragm muscle. So I believe Zane mentions the diaphragm muscle also. So I've done some work here to clarify some of those things. But anyway, we'll move right into it. Our correspondences here. I have the benefit of having had a medical anatomy course in medical school, so I know a lot about the organs and the zones and the regions here, and some of the terms that are used in the book that some people might not know the relevance of. So we can see here Aries is, by the way, the energy of Aries. Aries, it's as a sign, it's very hot. It's the most dry of the signs, right? It has fair movement, a little bit of movement, okay? And the ruler of Aries is Mars, right? So if we're going to look for influences in this zone, we're going to look in the sign Aries and also the sign Mars, which by rulership has an influence back into Aries. Okay, so we have, it's the head and the face with the upper jaw. It's not the whole jaw. If you look at a skeleton, often you'll find skeletons. Archaeologists find skeletons and they look like this because the lower jaw is missing, right? Because it falls right off, right? It's down here. So we have it's the upper jaw, the cranium. In Zane's the terminology, the cranium is the bones that cover the brain, right? Okay. The cerebrum, right, is the uppermost part of the brain. This is the part of the brain up here, and this brain has two hemispheres. You can see here the brain here has two hemispheres. That's the thing you see in zombie movies, right? So that's the brain, the cerebrum. Okay. Now he mentions also what he as the term the internal carotid arteries, and I thought in this presentation I would show all the things that he mentions so people understand what he was talking about. I have looked here. It says it rules the brain and the head. I've studied some charts of people who had head injuries, right? And one of them very notably has no discordant, only the very most minor, tiny little discord to the planet Mars, and nothing in Aries. And the person had a series of like 10 concussions. And what I find in charts like that, Mercury is prominent and severely afflicted, right? So sometimes in this area, you might not see something in Aries affecting the brain, because sometimes Mercury, by co-influence there, is ruling that. So here, these are the terms. This is, he mentions the term Zane uses as the cerebrum. That's this brainy thing up here. And he mentions the internal carotid artery. With the carotid arteries are the arteries that come up through your neck, right? And they're very close to your heart, right? They come up with a lot of high pressure, right? Comes right for heart. Boom, high pressure artery goes up your neck, goes over to a little arch and then up your neck. And this one, the carotid artery, branches here in your neck, and one of the branches goes to the chin and the jaw and the face, and the other branch goes deep inside the brain. So this is I'm clarifying the term that Zane used. The internal carotid artery is the carotid artery that goes into the brain and promotes circulation inside the brain. Okay. Okay, here is Taurus. Taurus, the energy of Taurus. Taurus is moderate, wet, calm, moist. So okay? And the ruler is Venus. So influences here will be found with planets in Taurus or affecting Venus. Okay. So it rules, this right below Aries, you have the neck, the ears going all the way into the throat to the tonsils, right? The tonsils in there, the eustachian tube running from the ear to the throat. Okay, and I'll show you some pictures of these. The cerebellum, we have the cerebrum is here at the top of the brain. It's the whole big cap on the brain. The cerebellum is this lower brain down here, right? And it actually, I think it shows better on a previous slide here. You see here is the cerebrum, and the cerebellum is down below it, right? It's a different set of functions, much more deep instinctual functions in the cerebellum. But by location, anatomically, it's very separate from the brain, as Taurus is separate from Aries also. So, and then it's the larynx and the pharynx. This is the vocal cords and the voice. Say if somebody has lost their voice, you might be looking in Taurus or Venus for that. I'm gonna, we have a famous musician. I'm gonna show his chart, a famous musician with a really rough voice. Who would I be talking about? Bob Dylan. Okay, we'll see. Bob Dylan has, we'll see what the Bob Dylan has in Taurus. Why don't you all just plan right now and just predict in your mind what you think planets he would have in Taurus to have a voice like Bob Dylan's. But here we go. The cerebellum, then this here, this is the cerebellum, and right behind it, the very backmost lobe of the brain is called the occipital lobe. It rules the vision, and this shows the occipital area of the skull in green there. So this is Taurus is the jaw, the ear structures in this lowermost part of the brain, and the bottom part of the skull back there. Okay. And I mentioned the carotids. It's the external carotids. It's the carotid artery comes up and supplies the face and the jaw. And then the blood that drains from the brain comes down through the jugular veins. Here is, this is all Taurus area here. This is the voice box here in the neck. Okay. This shows the blue there is the jugular veins that drain the blood from the brain. They come back to the heart. Okay. These are the tonsils. Tonsils are a massive lymphatic tissue. They're like a lymph node, right? Kind of lymphoid tissue in the back of the throat there. There's also lymphoid tissue is all around there. There's a ring of lymphoid tissue all around the gullet there, so that when you swallow something, you go lol glug, right? And you squeeze a sample of whatever you're eating into that lymphoid tissue, right? So your immune system it has to get past the gate, and the guard takes a sample and by the time it gets down to your stomach or down in your intestines, the immune system's already starting to prepare for it if it's something that's not friendly there. So but that whole area there, it's an important area. And here the ear, you can see the ear, you have the tube comes into the eardrum, and then you have the inner ear here, and you have a tube draining the middle ear, and it comes down into the throat down here by the tonsils. And so all of the whole structure and the area in there is all ruled by Taurus. I have a chart here. This is our first assassination chart. I have a collection of assassination charts. I'm not grisly. It's just that there's no question about where the bullet went, right? What zone the bullet went into, right? So this is rather dramatic here. This is John F. Kennedy was assassinated, and actually they show the path over here. The bullet went through the lower part of his brain and through his throat, right? One of the bullets did that. And that in this diagram, it proceeds afterwards to injure the man in front of him. But the actual wound, this says the first bullet, well, yeah, the back of the brain and exited the throat. This is a quote: extensive injury to the right cerebellum and the right occipital cortex. Do those words look familiar? That's exactly the words we were using to describe the Taurus area. And here we look at, so what does John F. Kennedy have in Taurus that might invite a bullet that would remove his entire cerebellum and then exit through his throat, right? And that is, he has Mars conjunct Mercury, very close conjunct Mercury in Taurus, right? And they're square, close square to Uranus here, okay? And then also, this will be a quincunx over here to the ascendant. So there's an aerial coming into the body to the ascendant. And so okay, this defines the zone of Taurus. And that wound, the wound he suffered, defined the zone of Taurus there. Yeah. I feel just a little edgy about showing assassinations, like I'm being grisly or something like that. There's something about the precision of the zone where the bullet went, you know, which has invited me to do this as a study. So I have about 4 or 5 assassination charts. I'm not going to do them all, but I'll do some of them. Okay. Okay, that's John F. Kennedy. Here we have, this is Bob Dylan's chart. Man with a famously discordant voice. A genius, absolutely a musical genius. He has tremendous harmonies there. He has this stellium of Taurus planets down here. A stellium of Taurus planets here, and with beautiful trine up here to Neptune. And so here, though, the voice would be where we find Taurus, right? And Venus also. So we have here a stellium of planets all conjunct Saturn. Okay, so that's not the marker for a beautiful voice, right? Okay. And then of course this has the beautiful Uranus Neptune trine there, to something to say there. And then the Venus would be, in this case, Venus would be a very secondary influence on Taurus because of all this other heavy planetary energy in Taurus. Venus would be a small subsidiary amount of energy added in there. Okay. So we have Saturn as conjunct the planets, and Mars is square to Jupiter in Taurus over here also. So Gemini, you know, Gemini, we'll say it rules the shoulders, the arms, the hands, and the bronchial tract, the respiratory tract, okay, and the trachea into the lungs, and it rules the upper part of the lungs. This is about the upper 2/3 of the lungs. I'll show you some pictures of the lobes of the lungs there. And these are people can remember, they think, oh yeah, well, yeah, the arm and everything, but it rules all this stuff that holds the arm up also. Okay, so this would also be here, the collarbone, the scapula. So it would be the everything, the supports for the joint, for the shoulder joint, and so on. So okay, and all the little fingers of the bones, and so on. I don't think it would be the one in the manubrium. I don't think that bone would be Gemini. I think it's the paired bones, right? But not the ribs. Okay, the ribs I believe are Cancer. So here, this is when they refer to the bronchi and the trachea. This is the windpipe. You can feel here the windpipe. That's the trachea. that's if somebody's choking on food up here, they'll make a little cut through the neck and they'll do a tracheotomy, right? They'll open up this so a person can get, if there's an obstruction up there, they can get air in there. And it's an emergency procedure that can save people's lives if they're choking. But so that's the trachea, the tracheotomy, and the trachea goes into this is called the bronchial tract. This is where you get bronchitis. It's inflammation and infection here in the bronchi there. And the bronchi, they really look a lot like a tree. They get smaller and smaller and smaller and smaller, and they get smaller until they're really, really, really small. So you have to see them with a microscope. They get so small, right? So, but this is the circulation, the windpipe circulation. So in the lung, here you could see the lung, and they show here outlined. I'm going to show you a better picture of this, but they show the lobes of the lung, and you can see here on the right side where the heart is, there's two lobes of the lung, an upper lobe and a lower lobe, right? And on the other side, on the right side, the left side, there's three lobes, two upper lobes and one lower lobe, right? This one has a little notch and an indentation in there because there has to be room for the heart. So the heart tucks in over here inside the lung, beside the lung over in there. But there is it's a fairly advanced anatomical concept. There's a differentiation in the lung between what happens in the upper lung and the lower lobe, right? And more of the gas exchange occurs in the upper lobes, right? And more of the blood circulation and the lymph and the immune processes happen in the lower lobe. So I actually had to research this on the basis of Zane referred to the difference between the upper and the lower lung as far as rulership. So I researched, I dug into some anatomy books on it, and they say, oh my goodness, they're like, there's overlapping functions, but there's different functions in the lower lobe, okay? And this can be relevant, you're gonna see this can be relevant to the COVID pandemic, the difference between the two. So here, now I have your interest. Yes, blood and lymphatic predominant in the lower lobes. Okay. In a group of 100 patients, this is from Zane's and the Church of Light Research, a group of 100 patients with pneumonia, infection of the lung, right? All of them had a progressed aspect to Mercury or to a planet in Gemini at the time of the illness, right? So this is a marker for rulership there. Now here, Cancer, when I started entering into this, I would have thought Cancer was one of the simplest ones, like Pisces. Oh, Pisces is the feet. Oh, Cancer is the breast or the stomach, right? And it's much more complex than that. It's that whole zone of the body, this whole area of the body, and a lot of its functionality. One of the energy of Cancer is cold. It's the wettest of the signs, and it's calm, and the ruler is the moon. So influences in that area we'll find in the chart correspondences with Cancer or the moon ruler. And it rules the breasts, the breasts producing milk. The diaphragm is the muscle that you breathe with. They're showing a picture of it here. They refer to it as a bell-shaped organ. It's shaped, think of the Liberty Bell, right? You can see here, there's an opening, big opening at the bottom, and it goes up here. And the bell the bell inverts, it pushes down into the abdomen or up into the lung, down into the abdomen, up into the lung, down into the abdomen, up into the lung. And when it's pressing down into the abdomen, you're fully inhaling, right? And when you're blow all the way out, it's pressing all the way up into the lung, and it's pressing all the air out. This helps me to understand why it would be one of the reasons. It has to do with with cancer is because this is the main pump of your lymphatic fluid. This is the main thing that moves the lymphatic fluid through your body, right? Your arteries have blood pressure, right? The veins don't have blood pressure, right? Except a little bit from gravity, right? And so what moves the fluid through the veins is like muscular contraction in the body. But so the lymphatic, every cell in your body has lymphatic drainage, and that lymph has to get back to the heart. And so it moves somewhat the way the blood does in the veins, but then also the lymphatic flow comes back, and there's a lot of it in the abdomen, and the pumping of the diaphragm up and down like that. Boom, that's the pressure pump that keeps the lymphatic flow going in your body. So this would be, so we have the moon ruling the lymph, right, and Cancer there. So this would be, you can see it's like this is the nourisher, right? You can see it's nourishing the whole body with lymph in that. So, okay, and then we have the stomach. Here's the boundary. I'm pointing here the boundary. The stomach ends here. It's called the pyloric sphincter. And after this, you have the intestine. And so this here is the boundary between Cancer and Virgo here. Okay. And the functions are very different here and here. All right. So I'll talk about that when we get to Virgo. Okay. We also have that the rib cage, the chest and the rib cage is ruled by Cancer. Here I have might as well have some astrology here and have an actual chart. This is a woman. This was she died in her mid-40s. I don't remember her exact age. She died of breast cancer, and this is when the frequency of breast cancer starts to increase in American women is in the 40s, right? And then after menopause, it's much more common. Breast cancer is the most common malignancy in women, and it's parallels with prostate cancer in males, about the same frequency and about the same mortality, and about 1 in 10 people, 1 in 10 women will have breast cancer. So we're going to look we're going to look in the sign Cancer, and we're going to look for the moon, aspects to the moon. And here we have Uranus is here in Cancer, and Uranus is square to the moon. Right? So here we do have a discord for Cancer and the moon. Now, last week we were talking about what we call aggravated aspects, right? And this isn't just a square. This square has the Uranus has a 45-degree aspect up here to Pluto in the midheaven, right? And then the moon end of it has a 135-degree aspect up here to Pluto in the midheaven, right? So this isn't just a square. There's a lot of discord in there, and this also brings the influence of Pluto in there, which can make things more serious and more drastic, an influence. Okay. I will point out up here the general for Cancer in general, Saturn is the significator for Cancer. That Cancer is a condition of low vitality, right? And it's a condition of a deficiency or lack, right? So here we have in this particular case, I knew this person was a patient and a client, and she has her Sun conjunct Saturn. She was very stern, very strict, very hard on herself, and I'm sorry to say she followed a very, very restricted diet, right? And I know some people follow a vegan diet or a raw food diet or different kinds of diets that aren't really robustly nourishing. And we see I've lived in Veganville almost my entire practice, which is either Boulder, Colorado, or Portland, Oregon, and we see a lot of people. As years go by, they become quite ill from not having enough of nourishment if they follow those kind of restrictive diets long term. And this was the case in her thing. So she had, this would have contributed here, the overall Saturnine aspect. And then this is a depression of the vital force, depressed vitality there. Okay. In my database where I did the 120 charts, I have 3 additional charts in there, and we might look at those when we do more conditions in more detail. But in each of those 3 charts, they all had natal and progressed discords to Cancer and or to the moon, right? Same as here. And all of them had at least one semi-square or sesquiquadrate involved in those aspects, right? So there was a question in the book. I looked in the books. I tried to find any astrological reference to what ruled the esophagus, right? You have the esophagus is here. There's the esophagus doesn't actually have teeth. That's your mouth up there. And it comes down here. And there's at the top of your throat, there's a sphincter there, muscular sphincter called the upper esophageal sphincter. If you have heartburn or GERD coming up and into your mouth, it's coming up through that sphincter there. And then the esophagus comes down and it passes along behind the heart, in between the lungs, and comes down to passes through the diaphragm. This is the diaphragm muscle here, and enters the stomach there. Okay, this is our esophagus. That's when you gulp up here, you gulp here, it gets right down there in a couple of seconds and it's in your stomach. And I was trying to determine the esophagus. Well, it passes through the throat, the neck, it passes through the chest. What would it be ruled by? So I thought to answer that question by looking at some charts of people with esophageal cancer, right? I'm not really ghoulish studying disease, but it's so precise. The anatomical zone where you have it is sometimes so precise. It's like a proof of astrology there. So this particular one, this is Luis Alvarez. He's a Nobel Prize winning physicist, and he died of esophageal cancer. And here, we have it here. Okay, good. He okay, at the time of diagnosis, here we go, Neptune. Here we have in Cancer. So we're going to look first esophagus. If it were Cancer, right, we would see something happening in Cancer. It should be pretty dramatic. If the person died of a cancer in that zone, there should be a pretty, not just a little minor aspect, there should be something very distinct there. So that's pretty distinct. Neptune there is opposite Uranus. Okay, that's pretty distinct. And then but then also this is this end of it is also semi-square to Mercury in the first house. And I say a lot of times for an illness, we see an aerial into the first house, something affecting the body, right, grounding it in the body. And so here, so there's that. So that's Cancer. What about the moon, right? The moon will also contribute to this zone. And so here's the moon. Oh my goodness, the moon is opposite to, it looks like it's opposite to Pluto and square to Mars. And that is Pluto square Mars affecting the moon. That is sufficient to bring a serious illness back into the zone of Cancer. Okay. At the time of, I put it up here, at the time of the diagnosis, the progressed ascendant is here in Cancer, okay, and is opposite Uranus. okay? And the progressed sun is here, and it's semi-square to Neptune, okay? So I'm going to reiterate, I'm going through these charts. I mentioned in the first couple of classes that how important I think semi-square and sesquiquadrate aspects are. And I think you see in these charts, like one after another, they really, it would be hard to practice without them. Right? Okay. There was another, this was another, I don't have the chart here. This was the guy the doctor who performed the first successful bone marrow transplant. Okay, he had a Pluto in Cancer as the leg of a T-square to a Moon-Saturn opposition, and I think that's pretty much all you need for Cancer, Moon, Cancer sign, Moon sign, and stress in there. Okay, at diagnosis, the progressed ascendant was conjunct to the Pluto, which is in the leg of the T-square. Okay. That's the same chart. Chest and ribs. This was Zane does not refer to ribs, the ribs or the chest as an area. And it was in Heindel, and I think one other source. But so I've looked, and this is Malcolm X, the African American orator and human rights activist, racial justice activist, a very powerful individual. If you ever heard him speak, it's electrifying the way he tells the truth. So here, but he was assassinated rather very famously, and he was shot. The autopsy report says shot in the chest 3 times, right? And here Mars is where the bullet goes, and the bullet is here in Cancer. It's conjunct to Pluto, a good significator for murder, and these are opposite the ascendant. Okay. And so this would be the gunshot wound in the area. This is aggravated 45 and 135 degree by Neptune. Neptune would be the planet of assassination and sneakiness. But it doesn't have a particular health indicator here. Now, in addition, that's Cancer. And then in addition, we have the moon reflexing back into Cancer, and the moon is opposite Saturn and square to Jupiter. Moon opposite Saturn. So this is a tremendous amount of discord coming here into Cancer here, and the outcome there was being shot there. So here are. I learned this entirely from Zane. I'd never heard it anywhere else, that the upper lung and the lower lung have different functions and different rulerships. This is a picture of the lobes of the lung on the left. This is where the heart goes right there. You have upper lobe, lower lobe, 2 upper lobes and a lower lobe. That makes it look like the lower lobe is kind of small, but if you do a side view, right, you can see from a side view, the blue are the lower lobes there. They're quite substantial part of the lung. And just by the force of gravity, there's more air at the top and more fluid at the bottom. So there's a lot of blood and lymph and fluid in the bottom of the lung there. And this would correspond to rulership by moon, right? Moon or Cancer. Okay. And here, it turns out we're in the middle of hopefully we're on the downside of the COVID pandemic, but the way many people die of COVID is the virus gets in the lungs, it destroys the lung tissue, and can cause blood clots in the lungs that can spread elsewhere. And generally, the diagnosis when most people pass away is COVID pneumonia. What they call it. It's an infection with the COVID virus and pneumonia. And typically they found that COVID pneumonia, the COVID infection that kills people, is typically an infection of the lower lobes of the lungs, right? Now, I have plenty of little scientific references to that, but you can take my word for it. The severe COVID-19 infection, you know, most people get it, it's mild, but if it's severe, it is typically centered in the lower lobes of the lung. And this is actually this is actually an image of COVID pneumonia. This is an X-ray. There's a lot of stuff you can't see on X-ray, and you'd have to be a radiologist to tell the difference between this part, which is normal, and this part, which is abnormal, right? But if people look at it every day, they can figure that out. But a CAT scan is much different. You can see things much more clearly on a CAT scan than an X-ray. So here they have an arrow over here pointing to, this is the lower lobe of the lung over here. And on the X-ray, the radiologist can say, well, this stuff over here, this is all, you know, a sign of pneumonia here. And this arrow over here points to the same place. You can see it better on the CAT scan, but you see these structures in here. That's lung damage, right? The virus caused lung damage there. So this is lower lobes. So I did manage to pull up. I found 15 charts of famous people who had COVID pneumonia, and they either died of it or they were intubated or received oxygen in the hospital for it, right? So this is, I think, you know, some future class I'm going to talk about specific conditions, and I might talk more about COVID at the time. But here, suffice it to say that 15 charts, they were hospitalized, they had severe disease, and they were supplemented with oxygen. That was my criterion. Some of them died and some of them didn't. Every one of the 15 charts shows discords to the sign Cancer and or to the ruler of the moon. Okay, no exception. Okay, in both natal and progression to the time of hospitalization. Okay, fairly strict criteria. Okay, and then each of the chart all likewise showed discords to planet in Gemini and or its ruler Mercury in natal and progressed charts. Okay, so here we have relevance of Cancer in the lower lobes of the lung. Okay. That's a bigger blown up picture there. I'm not a radiologist. I had a student who went and he ended up going to medical school, and then he went to then he became a radiologist, you know. But I knew him as a master tracker. Like, he could do animal tracking, right, in the wild, and he could see things in the tracks there in the leaf litter or whatever that no one else could see. And now he makes his living seeing things on X-rays that no one else can see, right? There's a certain refinement of observation. You can find that. But anyway, this over here is abnormal. Lower lobe of the lung, there's an infection there, and it shows better on the CAT scan. I don't know if this is too much detail, but I want to talk about this. This is an example of this man. This is Herman Cain. He's the former presidential candidate, a friend and a supporter of the former President Trump. He developed COVID, and after about 3 or 4 weeks, he passed away. And he was put on a ventilator for the COVID, and he died in 2020. So here in the chart, we're going to look for Cancer, right? The theory is that Cancer and Gemini will both be involved, but here we have Cancer. What do we have in Cancer? Okay, well, we have Saturn in Cancer. That wouldn't be too good, right? If you're thinking about health of the lower lobe of the lung. Okay, and that Saturn is it's also conjunct Mars. We have the two malefics. Now, Saturn's in Cancer and Mars is in Leo, but Mars adds its discord to that Saturn in Cancer. They're both square to Jupiter, okay? And then this, again, we have here that I described these. This is a square. It's not just a square. It's an aggravated square right? It has a semi-square and a sesquiquadrate over there. And these are like agitating, irritating both ends of the square, right? And adding discord to that fundamental conflict there. And this goes up to Mercury. Now, Mercury is significant here, and Mercury is breathing, right? And Mercury also reflexes into Gemini, which is the upper part of the lungs, right? So here we have Mercury involved in there. Also then we're going to look for Moon, okay? And here the Moon is opposite to Jupiter and Neptune. Here we have, Neptune is a planet of infection. Mars is infection, but Neptune is susceptibility to infection. There's a weakness. Neptune afflicted. Neptune has a weakness and able to be infected there. So Moon is opposite Jupiter and Neptune, and okay. Progressed for timing, the progressed midheaven is semi-square to Saturn here. Okay. This is our primary significator of the lower lobe problem in the lower lobe of the lung, and suffocation there is Saturn there, and the progressed midheaven is activating it, 135-degree aspect. And then the progressed Sun here is square to natal Mercury. Okay. Now, I didn't elucidate everything here as far as looking at the Gemini side of things, but here we have Uranus here is in 15 of Gemini, and this is going to be square to the ascendant and the Pisces planets over here. So we have the natal discord in Gemini and to Mercury, and then the progression to Mercury setting it off. So here, this is COVID pneumonia. We have both Cancer and Mercury involved in that. Okay. All right. We have Leo. Energy. See, the energy is hot. Planets, afflicted planets in Leo might have more heat than if they were afflicted in another zone. So it's the most dry, along with Aries. The ruler is the sun. So we look to planets in Leo or to the aspects to the sun. It rules the spine, in the back, and the heart. Okay. And for the spine, it rules the whole spine, all the way from the little tip of the coccyx all the way up to the atlas and axis that hold up the skull, the whole spine. That's all ruled by Leo. Okay. And we have, okay, that's a map of it. The back and then the heart. Here is the heart. Here they've pulled back what was on top of it. You can see the heart and then the major veins, or the blue veins coming in and the red arteries going out and so on. And you can see here the coronary arteries. This is the blood flow back to the heart muscle. Okay, I'll have a diagram of that in a second. Okay, all right. This is coronary arteries. You can see here's the heart. This is called the aorta. That's the aortic arch. This is the main blood flow leaving the heart, right, into the arteries, and then that feeds the whole arterial system. It passes through there. These arteries go up to the head right away. But the first thing it does, it takes back, well, we need a little bit of that for ourselves, right? So right where the aorta branches off, the arteries come and they bring blood flow back to the heart muscle, right? Because the heart muscle, it requires a tremendous amount of energy. You can imagine beating constantly like that. It requires a tremendous amount of energy. So we have there are four main coronary arteries. I don't think they're all visible here. And so they're nourishing the heart muscle. When somebody has a heart attack, right, there's a blood clot, right, forms, and a blood clot forms, and one of these arteries gets blocked. And part of the heart muscle then starves for oxygen. Okay. That can be a little transitory thing, and a person can have a first cousin to a heart attack. It's called unstable angina, right? But if the blockage is severe enough and long enough, part of the heart muscle will die, right? And then that will be scar tissue there then. And so of course then the person can die if the heart doesn't work right, or the person can have problems with heart rhythm and other things like that if part of the heart has been damaged by a heart attack. But so this can cause sudden death. All right. I always like to mention, when I mention heart attacks, medical history, they have a lot of medical history in the four humors system, going all the way back to the Greeks, the Egyptians, and so on. And they recorded the kind of things people died from, and no one ever recorded people dying sudden death with a stabbing chest pain with pain radiating down the arm until 1807. That was the first recorded heart attack in Western history. Right? And so this is not a way people, it's a modern disease, and it has to do with the industrial era. It has to do with the sugar era. I don't know if you know, the average American eats their body weight in sugar every year. And this is a food that it's not good for you, right? So, and it creates a cluster of diseases that can include heart attacks. So anyway, we'll see here a heart attack. This is Zane and the researchers from Church of Light. They found that Jupiter was invariably involved with heart attacks. Now, Jupiter rules the arteries. We'll do planets next week or the week after. We'll start doing, but Jupiter rules the arteries. So our Jupiter is a constant for heart attacks because of this physiology in the heart. Right? Okay. We can do a chart here. This is literally the man without a heart, right? This is Dick Cheney, architect of the first Iraq War, architect of waterboarding as strategy, and so on. He was convicted in an international court of being a war criminal, he's a politician, Secretary of Defense. I won't go into all the dirt on him. Advocate of policy of torture for Islamic prisoners. Okay. But the medical thing, this guy had multiple heart attacks. I lost count. I believe he had 8 stents put in his heart. When you if the artery is blocked, they can do a surgery, and they can put a little retainer in there to keep the little coil to keep the artery open, right? And I think he had a total of 8 stents put after multiple heart attacks. He had one after another. I'm assuming because he's wealthy and famous, he probably had an ambulance on call. For when he did it, he got the very best healthcare in the world. So he got to live a long time with a lot of heart attacks. Eventually, he had a heart transplant. Okay. And for a period of some months, he had an artificial pump, and he didn't have a heartbeat or a pulse. Now, I'm going to tell you, if this guy doesn't have a whole lot of discord in Leo and the Sun, I'm going to find a new profession, right? Right? This is it better be dramatic, man, for somebody to be that sick. Right? Okay. Is that dramatic enough here? I'll go over the details. That's dramatic. The dotted lines are all semi-squares and sesqui-squares, right? And there's 2 T-squares involved, right? And we'll start with Leo. He has Pluto in Leo. Pluto in Leo is opposite Sun, the ruler of Leo, right? So you could call this kind of the backbone of the discord in the chart, okay? And then here we have a square to the most malefic planet, Saturn, square to both ends there of that opposition. Okay, well, that's pretty bad. Okay. And then if we look at this, the planet in Leo, it's also 135 degrees from Mars, the other malefic, right? Okay. And then Sun not only is opposite Pluto, it's 135 degrees from Neptune. It's 45 degrees from the moon. It's square to Saturn and Jupiter, right? And this is just, both of these T squares are just completely aggravated. Here, Mars, this square from Pluto to, yeah, the square from Pluto to Saturn and Jupiter that square is aggravated by Mars with a sesquiquadrate to both ends of that square. Okay, so I'll keep my profession, right? We'll keep going on. This kind of discord is reflected in that man's heart history, right? Unusual. Okay. Virgo, all right. Virgo rules the abdominal and umbilical region. Umbilical refers to the belly button, so in that area, the abdominal region, and in particular, we have in the digestive tract, we have the stomach, right? The stomach, and then we have intestines called the small intestine. There's three different sections: the duodenum, the jejunum, and the ileum, and then we have the colon. Okay, and the functions are very different in those three areas of the digestive tract. The stomach is more preparatory. The actual digestion and breaking down of things occurs in this Virgo area, and I like to think that, you know, like Virgo is analytical, right? Is the intestines analyze and rip apart everything, right? And they actually turns what looks like food when you eat it. It still looks like food when it leaves your stomach, and it's completely liquid by the time it leaves the small intestine. There's nothing solid left in it by the time it leaves the small intestine. So it's all very much broken down. So that's the Virgo function, the Mercury functioning happening there. We say this region, it starts at the pyloric sphincter at the stomach. And then there's a valve here where the small intestine goes into the colon. I'm going to show a picture of that in a minute, but that would be the other end of it. The function in the colon is very different than the function in the small intestine. There's no more digestion happening there. You now have fermentation happening, right? It's like your compost pile down there. Okay, so it's very different than the digestion happening in the intestine. Okay. Here is our famous Indian author, Rudyard Kipling, many stories. But Rudyard Kipling, we do have, I'm not doing progressions because we have a possible birth time. It isn't a precise birth time. We had a B rating instead of an AA rating. And but here we have then on the night of January 12th, he suffered a hemorrhage in his small intestine. He underwent surgery. He died a week later of a perforated duodenal ulcer. Okay, the duodenum is the upper part of the small intestine. So here we're looking at Virgo. We're going to look at Virgo, or the ruler Mercury. Now, here we have in this chart, we have Virgo ascendant. Okay, the ascendant is it's empty. There's nothing in the first house. So we have for the Virgo influence, we're going to have I didn't mark it on the chart. We do have a square here from the midheaven and the moon are square to the Virgo ascendant. There's some stress in there. But the ruler Mercury, now this guy bled. I mean, he had a perforation, a puncture of the ulcer, ate its way through the wall of the intestine, and the contents of the intestine went into his peritoneal cavity, and he bled, right, from the injury. So we're looking for Mars here. And here we have Mercury, the ruler of the ascendant, is closely conjunct Mars. Closer, less than half a degree. It's unusually close conjunct aspect, unusually powerful and discordant. Okay, and these are opposite to Uranus and the moon. Okay, so this would be the fundamental discord there. We do have Mercury. This is these three planets are there. It's a very powerful stellium and very discordant with with Mars there. And once again, we have an aggravated situation here. It's 45 degrees over here to Pluto, and also 135 degrees over here for that aspect. Okay. And that's Virgo. Okay. We might not get all the way through the zodiac tonight, but maybe we will. Here. So Libra and Scorpio is where we start getting into, sometimes there's vagueness in what rules what. Okay, so I hope to give precision here. Libra energy is cool and moderate. There's dry. Movement is some movement. The ruler is Venus. Okay, the lumbar region, this is the area kind of below your ribs in the back. Okay, your lower back. The kidneys, this is the kidney. The ovaries, now this is from Zane. He says the seed, that would be the semen. Okay, and also the internal generative organs in general. This is the quote from Zane, right? And so I'd like to, and then we'll see that Scorpio rules external. So I'd just like to clarify what's internal and what's external, and which would be a Libra and which would be Scorpio in here. It can be ambiguous. First of all, this is the kidney. This is the kidney, and you have the blood supply comes in here, through the artery, and the blood goes all the way out here to the far end, and then excuse me, and then it comes back through all this massive tissue, which filters it. It filters the blood, right? And this is proof that it's Libra, is that first of all the blood plasma goes over onto the kidney side, right? This is a joke. And then and then most of it is taken back, right? And then some more of it is secreted back out, right? So some of the, depending on the substance that's there, it pretty much it says, well, everything's guilty until proven innocent. We're going to put everything over there, and then we're going to take some of it back, and then we're going to spit some more out, right? And I like, this is the this is the Libra, you know. As also on the other hand, right? Or on the other hand, this is a joke. Everyone's supposed to laugh, right? Okay, so but it's the filtering is there. That all that going back and forth, that's all Libra function, right? That's all trying to decide. That's all judging. That's weighing, right? What should we keep this or should we get rid of that? That's all going in there. And then it collects in this open area here. And this area is called the renal pelvis. And so when you read Zane, he says the kidneys are ruled by Libra. The pelvis of the kidney is ruled by Scorpio, okay? Because the pelvis is connected by a tube to the bladder, and the pelvis and the bladder, they're collecting tubes for urine, so they're ruled by Scorpio, okay? Here is then the female reproductive. This is the uterus, right? And the uterus, these are the two ovaries. And the ovaries have the fallopian tubes. The egg is secreted there. It moves the fallopian tube, comes to the uterus. If it meets a sperm cell there and becomes a fertilized egg, it can become implanted, and there's a pregnancy. Okay. So this is, there's no question here that these are internal, right? The ovaries are internal. So these are ruled by Libra. This is using same terminology here. Okay. But here, you know, they call it the urogenital system because it's all kind of mixed up in there together. The reproductive function and the urinary function, they're all kind of mixed up anatomically and to some extent functionally, depend. So this is a picture of the urogenital system, and you would say it would start with the kidneys, okay? And then the kidneys have ureters, which bring urine down to the bladder, okay? And they aren't showing here. In the female, we would have ovaries on the side. In the male, we have testes in the scrotum. Okay, and here this is the bladder. Right below the bladder, we have the prostate gland. Now I'm going to show more details of a lot of this. So, but in general, you say, well, it's the urogenital system. It's all kind of a mishmash in there. Generally, the paired organs are Libra and the single organs are Scorpio as you go down that. Okay. And that would be a way of thinking it. So here the kidneys, right, are Libra, right? But the bladder is Scorpio. Okay. And the prostate gland is Scorpio. Okay, the external male reproductive, the penis, is Scorpio. Okay, coming down here, the female, the same kidney, bladder is Scorpio, and the ovaries would be Libra. And here we have, I'm going to show some detail. The whole erectile arousal function in here is vascular, and that has to do with Scorpio. And we have a corresponding erectile arousal function all around the vagina. It's the clitoris, and that's Scorpio. The arousal function in those tissues that would be ruled by Scorpio. Here, and then here's some more. This is, we use the term homology. If say between a male and a female, you have an embryo, a human embryo, you can't tell whether it's male and female for a long time, right? And then they'll develop, and then certain things develop from certain areas of the embryo, right? So here, and then the tissues that developed are called homologs or homologous there. So here you'll have you have here the ovaries and the fallopian tubes on the uterus, and here you have the testes, right, and the epididymis, right, and it comes down into the to the prostate gland in the penis, right. You can see embryologically these came from the same place, right? And the reason I want to clarify this is the question, if he says the internal reproductive organs or the external reproductions, what are the gonads? What are the male gonads, right? Are they internal or external? And the fact is they're internal, right? Even though they're external to the core of the body there. So if this would clarify that. This is, we have here this is the prostate gland. I'm going to talk more about the prostate gland. This is the bladder. Okay. So, and for reproductive function, the sperm cells come from the testes and migrate up here. The ejaculatory fluid comes from the prostate, and these are called seminal vesicles, right? And then this area they're showing here, this spongy tissue here, that area can be either very, very full of blood, or it can be drained of blood, in which case they can be more erect or not. They're in the female. I'll come back to that in a section. I want to finish this. I couldn't find definitively in the book what ruled the testes, right? So I did this work. Testes and ovaries, they're homologous structures. This shows the kidney. This is in a young, very 7 weeks old embryo, right? And here you see a gonad is starting to form. If it's a female, that becomes an ovary and it stays internal. If it's a male, it migrates down into the scrotum, and to some extent that's external to the trunk of the body, right? So, okay. So, all right. Here, okay. Here. I wanted to had the question, because the question, it isn't in the books, what rules the testes? I got some charts of testicular cancers, and they're, I think this is the one here. Sebastian Joly French, who was a French, Joly, a French road racer. We're going to look to if it were ruled by Libra and Venus, we'd expect to see stuff in Libra and Venus. So here we're going to look. Here is Pluto in Libra, okay, and it's a square up here. It's square to Venus, the ruler of Libra. So we have this square discord in here, okay, and then yes, there's, and then okay, yes, these, the ascendant and they're square to the moon and square to the midheaven and to Mercury, okay, and okay, and yes, okay, and then Venus over here, Venus is square to Saturn. This is our general ruler of Cancer, is Saturn, and opposite to Neptune. So and then and this one is aggravated. The Venus-Saturn square, right, is aggravated by Mercury exactly halfway between, with a 45-degree aspect to each end of that square, which is just completely activating that square and adding to its discord. Okay. I do have a chart. I did. This is an example chart. I pulled up 8 patients with testicular cancer, right? Each had natal afflictions in Libra and or to Venus, the ruler, and also to Saturn. Okay, and on progression, all had an aspect to Libra planet or to Venus, which I'm not going to go into the details here, but okay. I think we should go back here to, no, I want to finish the, I'm sorry, excuse me. I'm having trouble with my slide progression here. There we go. I want to go back to the kidney stone. This is the singer Billy Joel. He had, this is the quote from Zane: a planet afflicted in Libra or Scorpio, or Venus or Mars severely afflicted. At the same time, Saturn is prominent and aspects the planets. I could say physiologically, why would he say Venus or Scorpio? I'm sorry, Libra or Scorpio. And the reason is, if we come back here to the kidney, this part of the kidney is ruled by Venus. This part is ruled by Scorpio, right? So often the stones can form in different places. Sometimes you can get a huge stone that fills up this whole space, but particularly the pain of the stone happens when it passes down into the ureter, which is ruled by by Scorpio, right? So we would have them being formed under the influence of Libra, but then they're causing their spasmodic pain in the zone ruled by Scorpio. So this would be why, and I'm not sure if Zane knew that. I think they just may have found that empirically, that the charts had one or the other in them, and that would make sense. Okay. Here, okay, that's Libra. We come to Scorpio. This is called the sinus or pelvis of the kidneys. The ureter is the tube down to the bladder. The bladder itself, the sigmoid flexure of the colon. I'm going to show that in a section. The rectum, the prostate gland, uterus, external generative organs in general, and the nose. Go figure, right? But it does seem to be involved. I don't have any cases of the nose in Scorpio, but we do see that as an influence. This is the colon, This is the whole colon. And I meant this is where the small intestine comes into the colon. This is called the ileocecal valve. Okay. And this liquid, it's liquid. It's like yeah, it's liquid. It's like maybe thicker than urine, but not much thicker than urine. It's liquid by the time it comes out there. It comes into this bottom part of the colon, and you have the appendix down here. I'm going to show you the appendix in a minute, a little more. So the appendix actually down there takes a sample of whatever's coming in there and sends out signals to the immune system. Okay. But so the colon is ruled by Scorpio. Well, it's eliminative, but also it's fermenting. It's a fermenting organ, right? You get about 10% of your daily calories from indigestible starches that are fermented in the colon and turned into nutritive fats, right? Yeah, the total calories you burn, it's kind of like the stomach of a cow that can turn grass into fatty acids. So we have that. We can't do it as well as cows did, but we can still do it. All right. Here is the appendix. This is a question. I couldn't find any rulership for the appendix. I said, well, that must be Scorpio. And we do have, Zane did suggest for appendicitis. They looked at appendicitis, that they found Mars and Uranus prominent in the birth chart. He doesn't mention sign rulership, right? I proposed and investigated, well, was the appendix ought to be ruled by Scorpio. That's consistent with Mars being prominent, right, in the chart, that you would expect something there for Scorpio. Okay. I'll finish Scorpio here, and then we'll move on for next week. Okay. I looked at a series of 3 AA Rodden rating charts with individuals with appendicitis. In each case, the major and prominent discords were present to a Scorpio planet or one of its rulers, natally and on progression. So this would be appendicitis. That's a small sample, but it's consistent with Zane's observation of Mars involved in that. And we could show one here. This is a man's name is Joe Gender, a Belgian artist. He had appendicitis, which wasn't treated, and he died of it. So here we can see Scorpio is on the midheaven. Okay, Scorpio is on the midheaven. It's square to Mercury, right? And then Uranus is semi-square to both ends. Okay, so we have some discord there. Pluto is in the stellium, and it's conjunct Saturn, right? The malefic conjuncting the ruler of Scorpio. Okay. And Mars is conjunct Uranus. Okay, that's Mars, co-ruler of Scorpio, is conjunct Uranus, discordant. And these are square to the ascendant. There's the aerial into the body. And you see the progressed Mars is sesquiquadrate to natal and progressed Pluto. And you see this is an overwhelming discord relating to the into the sign of Scorpio there. Okay, one more part of Scorpio. I think that's the same chart. Show that, yeah, I'll finish Scorpio here. This is the prostate gland. For people who don't know where it is, you have the bladder, and the bladder, the urethra, the urine goes out through the urethra in the male, out through the penis for urination, but it passes through the prostate gland. The prostate gland surrounds the urethra completely. It's like a straw, I say, a drinking straw through an apple, right? And so what can happen here, it's very common, in fact, it's normal, as males age, the older age, that the prostate enlarges, it grows. It isn't like it swells, right? It grows, it can get too much tissue there. And as it enlarges, it can put pressure on and make it difficult to urinate. So this would be benign prostatic hypertrophy, enlarged prostate, very, very common in there. And then this is a picture of it happening. And over here, this is a picture of prostate cancer, right? And this is the prostate. It's the most common malignancy in males. It's as common in males as breast cancer is in females. And here's the issue. If somebody starts getting a urinary obstruction, right, is it benign prostatic hypertrophy or is it a tumor? There's no way to tell from the symptoms, right? So this is why urinary symptoms always need to be examined by a urologist, right? Because it's such a common cancer. Okay. I won't go into that much more. Here, I wanted to show the anatomy. Maybe it's one of the mysteries of male health is why does the doctor put on a rubber glove and palpate your prostate through the anus, right? It's because you can, right? You can, the prostate is right there next to the anal wall, right next to the rectal wall there. So, if they can feel, this was the old way before they had imaging, if you feel anything lumpy there, it's probably a tumor, right? If it feels soft and fluffy, it's probably enlarged prostate, right? So that was the old way of doing it. Okay. Yeah, I did a series of 10 patients with prostate cancer. They all had natal and progressed discords to a planet in Scorpio, its rulers, and also to Saturn. This is the picture. This is the uterus is ruled by Scorpio. Okay. You would, the uterus holds the, well, we know what the uterus does. The uterus holds the baby, but the uterus also, it's constantly regenerating and sloughing off the lining, right, to prepare that. So the whole process of menstruation comes, and this would be ruled by Scorpio. Okay. I'll close with this. These are also homologous structures. I know many women do not understand the anatomy of their own erectile tissue. I know it's a fact. And that here in the male, these are developed from the same tissues embryologically, right? And in the male, this area has vascular tissue where that can become more or less engorged with blood and can become more erect. And this is the homologous tissue, and all of this tissue and more in the female can become erect and engorged with blood in the same manner during arousal. And so these tissues, this is Scorpio, okay. And this is another picture of that. This is in all our medical school physiology books. They show the corpus, the corpus cavernosum. It's like a cavern, right? And that this is vascular tissue, and it can become engorged with blood or drained of blood. And there is exactly an analogous tissue in the female here. And they see this is paired. These are paired. This is the same paired embryological tissue is erectile tissue in the female. And here we have erectile tissue around the urethra, and here erectile tissue around the urethra, and so on in other around there. So this is the other question. It's if he's talking about internal or external. To clarify, it's obvious the penis is external, right? But it's not so obvious, but all this erectile tissue here, even though it isn't outside the body, it's external. It's the Scorpio rulership for erectile tissue in both sexes. And I think I have to stop for the night. And thank you all very, very much.